recovery. I want to talk about recovery today. And recovery can mean a lot of different things. Right off the bat, people might think of physical injuries. Someone who's had back surgery because they were in a car wreck, and perhaps they're going to go through physical therapy after having a back surgery, and hopefully to get stronger and get physically well and be as good as they were before. Or maybe they broke their arm and had their bones set and they wore a cast, and so on. You get the idea. People who've been injured and needed some type of intervention to get better, medically speaking. So the type of recovery I want to talk about is alcohol and substance use addiction, or use disorders, as it's called in the DSM-5 manual these days. So really, a lot of things can come to mind. There's so much that can be said. So I'm just going to kind of shoot here on a few points that come to my mind when I think about compulsive drug use addiction and drug seeking type of behaviors. I want to hit on a few things. One of them will be about the personal responsibility of the individual as it relates to their recovery. I think we do a lot of things right in the industry that is out there to help people in recovery from addiction, but we also, in my opinion, and I speak for myself, I don't speak for any agency or other people, but I feel in some ways we do a disservice to individuals because we're afraid of political correctness. We can't say some things that need to be said to people in recovery. It's always been of my thought and opinion that the number one basis to give you the ability to change is by operating off of the truth, making decisions off the basis of what is true and what is known. And so going by that, you have the power to change your life. If you make decisions based on distortions or things that are not necessarily true, you're not really gonna, get yourself where you need to be. And I'll speak to more what I mean about what I just said here in a little bit in this video. So let's talk about. Let me kind of get this video a bit more focused, because there's different populations you can look at. There's people who have mental health problems, who have underlying mental illness. It could be mood disorders like major depression, dysthymic disorder, bipolar disorder, and so on. They have a physiological issue that they may be predisposed to. They need medical treatment for that. You may have an individual with schizophrenia, which is progressive and developmental in nature. That's a degenerative disorder of the brain, organic in nature. These individuals are predisposed and born with these type conditions of no fault of their own. And so you get the idea. Some individuals have mental illness. So what you will find sometimes are individuals who have a co-occurring situation where they have an underlying mental health issue, mental illness, and they develop a substance use disorder and or alcohol and drug type of addiction and compulsive behaviors that go hand in hand. That's the type of population that requires a multifaceted approach into how you're going to treat those individuals. But I want to direct this video towards the population of individuals that do not, I repeat, do not have an underlying mental illness, a mental health problem. In fact, a lot of times you look at their family history, there's no real family history of a mental illness or mental health type problems. So what am I going to get at here? We're going to look at problems that are caused primarily by choices, behaviors, and characterological type issues, dealing with personality, coping skills or lack of coping skills and thereof. So when we look at these types of individuals, what's going to be the basis for recovery? And I'm going to talk about motivation and personal responsibility of the individual for themselves. Now, at a certain point, and you look at, initial drug use, there's different types of, stages of denial, and then up to harmful dependence with a drug. Initially, in the beginning, a person may not necessarily have any negative consequences happening to themselves. They may not have necessarily developed any type of tolerance to the extent where they're having any withdrawals yet with a drug, substance, or alcohol. So at this point, they don't really want to recognize, or maybe they don't recognize, to be able to acknowledge that they may have a problem. Then you kind of get in the middle level of denial where these individuals may start recognizing, hey, yeah, some things are happening. Maybe I'm having problems with my marriage or relationships at work, for example. Your work is starting to suffer. You're not managing your money as well, and so on. But, they still don't think they have a problem. And then it can progress to harmful dependence. This is where, when you're looking at tolerance with a particular drug, where it takes increasing amounts more of that particular drug to achieve the same results as far as getting high, euphoria, and so on. And in some cases, depending on what type of drugs you're talking about, whether you're looking at stimulants, alcohol, opiates, and so on, you can get to a point to where they, go from essentially normal to euphoria, which is getting high, and then back to normal again, when the drug is metabolized out of their body and their system. Two, once they're far enough along in the addiction, the tolerance is built up. These individuals, they lose that normal of what their baseline was. What they'll get now is what we refer to as withdrawal symptoms. Those can be acute withdrawals, and then you can, depend on the drug we're talking about. Alcohol is one of the most dangerous drugs to detox from. For people who have a severe physical dependence on it, they can have seizures, DTs, and so on. And those of y'all who are familiar with that know what I'm talking about. And not to go into too much detail into that, because this video is going to be about more of a different focus, but I just want to touch on that. You get the idea. Dangerous withdrawal symptoms with alcohol, it can kill you. That's why they have to get a medically supervised detox. Librium taper is usually what will happen to get them to where they're medically stable and they're safe. They're out of the danger zone to where they could die. So benzodiazepines, similar to alcohol a little bit, to where you can have the similar type of withdrawal symptoms, seizures, and so on. So with opioids, these individuals, once they develop the tolerance and then now have an addiction, they will get what many refer to as being dope sick. And I'm touching on the physiological responses to tolerance and withdrawal now. So they can have diarrhea, bone aches, muscle cramps, chills, runny nose, tearing eye, anxiety, irritability, and so on. And with the opiates and opioids, these individuals, they don't even really get the same original high that they used to be. They're now essentially are caught up in a cycle of they're chasing to the next fix they can get so they don't get sick. And, that's a terrible place to have to be in. So we're talking about the physical aspects of tolerance and addiction, withdrawal, and so on. So with that process going on in individuals who don't have an underlying mental health problem, you're looking at a behavior pattern of drug-seeking behaviors. You can look into other issues of them getting their needs met, whether it's wanting to feel love and belonging can be one, survival, people that are financially struggling, or maybe they just got other types of stress that's upon them to where they feel like they're in a survival mode type situation. They don't have good coping skills, and so they resort to using drugs as their means to cope with stress. So in these type of situations, these individuals who don't have an underlying mental health problem, they can experience mental illness or mental health type symptoms that are secondary to the drug use. Anxiety can be one when they're having withdrawal. Specific to stimulants, if you haven't slept in 4 days because you've been on methamphetamines, cocaine, and so on, you can have a sleep deprivation induced psychosis. You're paranoid, audio, visual hallucinations, and so on. So you can be psychotic. It doesn't mean that you have an underlying mental health problem. It's just being caused by metabolic disruption, like a delirium, for some individuals who have reactions to drugs and so on. They can have a break in a reality or have psychosis. They're not, they don't have a mental illness per se that is the primary cause. They're just having a reaction to a drug, and in the case of stimulants, if you haven't slept, that can be sleep deprived as a result. So if these individuals, the point that I'm getting at is that once they achieve abstinence, long enough, from the drug, and they're in the safe zone. They went through a medical detox. If it's opiates, they needed some medication to help make it a bit more comfortable while they're going through the process of transitioning into abstinence. Medication assistance treatment, as it's referred to sometimes. Or the alcoholic that needs a Librium taper so they don't have seizures and die, and so on. Once they get past acute withdrawal, once they've been, abstinent long enough, you can talk about post-acute withdrawal symptoms that can go on for a period longer, 6 months to a year or more. Once you have enough distance between the drug in your system and you're past all the physiological, issues you're dealing with, it now boils down to behavior, lifestyle, coping skills, and what you value. I'm going to talk about that is your value system. So with these individuals who get into compulsive drug use, I'm going to give a quick example about the value system. Is that you can force abstinence on people. It happens all the time. They break the law because they're caught up in criminal type behavior, criminal thinking, also called an antisocial personality disorder or characteristics. Goes hand in hand with criminal thinking and these types of behaviors, assaultive behaviors, burglary, these types of things that they have no regard for the rights of other people. Basically, anything to get their needs met. And a lot of times a drug habit or addiction. So these individuals, they get incarcerated and they can be in prison 2, 3, 4, 5 years. And yes, you can get drugs in prison, but in a controlled environment, it's harder to get drugs. I've known people who've been in prison and did not use drugs for 3 years, 4 years, and they get out, and despite having had abstinence from drugs all that time, they're not sick anymore. They're medically stable. They have their physical health. They've been working out in prison and so on. So what happens is that they never were truly in recovery, because what constitutes recovery? And that's what I want to talk about. What constitutes recovery is a change in thinking, a change in your coping skills, and what it is that you value. If that hasn't changed, then you never were in recovery to begin with. These individuals I'm talking about, as soon as they get out of prison, they go straight to a dope house where they start drinking, they start using. They go right back into the same MO, same behavior, same pattern, same drug-seeking behaviors, and they're right back at it, just right where they started. So you can't force recovery on people. You can force abstinence, but you can't force somebody to change what they value. So when I speak with friends of mine, people that I know who've been to prison, who used heroin for 20 years, what it boiled down to, and they admit to it, is that they finally changed what they valued. They decided that their health became more important to them. They had a goal that they wanted to regain their health. They wanted to stay healthy. They didn't want to just burn out and die. So that changed for them, and they flat out said it. If it wasn't for them changing what they valued, their family, for instance, their value for their family became greater than what their desire to use drugs. So the value for drugs decreased, the value for family, for health increased. And that's not something you can make happen in a person. It speaks to the issues of a person's character, their personality, and what makes them tick. And that's the complicated thing about recovery and people go into rehabilitation centers, supported residential, inpatient. It doesn't matter how much money you spend on these individuals in treatment. It doesn't matter if they are in there for 6 months, a year. It doesn't matter if they go to a treatment 100 times. It's not until the one time that the treatment will stick to them or recovery sticks. It's not until they're ready, they're sufficiently motivated to stay in recovery, to be well. They have to value that. And it's just what it is. It's not about a moral judgment. It's not about saying, this group of people, they're just bad and these people are morally superior or any of that. It's just an observational fact. And the word judgment in and of itself is not a bad thing. It's just merely making an assessment of what is fact and what is truth. So the basis for change is by going off of what is truth. Truth is going to get you to where you want to be. And the truth is that you have to have a shift in what you value, your value system. Values essentially is how you assign worth to any particular thing person or situation. Your behavior and your choices and your decisions are going to say what you value, what you're assigning worth to. You can't say that you value your family. You can't even say you value your own health if you're out, after you've had medical intervention to be medically stable and you have resources that are being put in place to help you to do the right things and to live a better quality of life. When you have all that there, and then you're going to go back into the same scenarios and situations where you're going to be using illicit drugs again, and just right back into the same behavior pattern all over again. You haven't really thought about changing as far as the decisions you're making. It's just superficial at best, and that's unfortunately what you get when dealing with individuals who are not ready to change yet. You get superficial, sometimes charmed. They'll try to throw the charm on, say things that people want to hear just so they can get temporarily assistance, just to get them to the next moment, the next day, or where they feel they need to be. They feel they need to be until they can go back to their same MO. And I know one individual who said he used to think about getting healthy enough just so he'd be able to use again. That's how severe his compulsive drug use was at that time in his life, until his values changed. His family became more important to him. His desire to regain his health and keep his health became more valuable. So that's where he assigned more worth into that situation, and then his investments and his resources followed that. His time, his energy, his money, his mind, everything followed in suit into that end. And this individual is still in recovery to this day. So it's what it is. It's a complicated thing when you're dealing with individuals with compulsive drug use. It's just a mixed bag of a lot of variables. But ultimately, it's up to the individual. They have to take responsibility for their decisions, their behavior, and making a change in the way they live their life. Stopping using drugs recovery is not just simply stop using drugs. It's about changing the way you live your life, how you cope, how you manage stress, and how you deal with relationships, and so on. So a lot of things can be said, and I'm just going to throw in a few more things specific to people that are really this hardcore into compulsive drug use. Here's what usually happens. One of two things. One, they get old enough where they just simply burn themselves out, and physically are just slowed down to where they just can't, keep up with the same pace that they used to when they were younger. So you'll see them slow down, and that may be enough just to halt their drug use, and then they have no choice, or they die. Number two, for the ones who have more of the criminal element, antisocial personality, they'll usually end up dead. They get killed. Breaking into people's houses to steal things, to buy drugs, at least in Texas, where I'm from, that can get you shot. So, you end up dead or in jail or, overdosed or so on. So that's the unfortunate reality for these individuals. So I'm not necessarily of one school. I believe of thought for how people can, get into recovery and regain their health. I think there's more than one path for individuals, and recovery can be very individual for different people. Some people are in the 12 steps. That's fine. For me, I tend to modify it based on my philosophy. For example, the first step is that you admit that you're powerless and that your life has become unmanageable. Well, I have to put that into context for people, because some people, they're not going to necessarily receive that the same for everybody. And I understand why. But it is fair to say that most reasonable people, if they really want to confront their behavior and their drug addiction, and especially if you've had a lot of serious consequences in your life, whether it's your health, social relationships, loss of job, physical health, legal conflicts, and so on, is that at a certain point in your life, you did have some loss of control. Your life did become unmanageable. And that's fair to say. I've worked with people who've been paroled out of prison. They want to argue about it. I'm like, look, you got locked up in jail, that in and of itself is evidence that you had some loss of control. You lost your freedom, okay? Your life became unmanageable, which resulted in you being charged of a crime, convicted, and placed in jail. So then what, though? Are people totally powerless? No, I do not believe that. In fact, for me, recovery is all about empowerment. Recovery 100% is about being empowered, that you do have the power to change your life. You have the power to live a sober life, to develop a lifestyle that supports sobriety, and to be in control of yourself. That's what recovery is about. It's about self-empowerment. So how does that begin? It begins with taking responsibility for all of your behaviors, even the ones that may be uncomfortable or cause anxiety, because it's a blow to our pride. We don't want to admit that we made mistakes. And here's the good news, though. If you're willing to take responsibility, even for those things that are not favorable, the good news is you're now in a position to change your life. Because if you can take responsibility for where you've made mistakes, you also, what you are indicating is that you have the power to make better decisions. So the fundamental attribution error is people typically will, by nature, we want to take credit for all the good stuff. I got a promotion at work. The boss promoted me because I work hard and I'm smart. I'm good at what I do. Or I made 100 on the test at school. For those who've been to college or you studied for an exam, you made 100 because of you. You put the work in, you studied hard, and also because you're smart. Or let's say, you ran a 5K and you got first place in your category, your age division. It's because you're going to say, I practice, I put the work in, I'm a good athlete, whatever it is. You're taking credit for that. You did that. It's because of your efforts. That's why you succeeded. However, if you do something, if you have a behavior that looks unfavorable, let's say, maybe you got upset, let's say you had a bad day and you acted like a jerk, or you called somebody some bad names, or you kind of lost your cool a bit at work, and then you get called out on it by your supervisor, or somebody talks to you about it. You're going to say, well, that wasn't really my fault. I didn't do that. It's because the way the person looked at me, or was their tone of voice that caused me to behave that way. So we make an external attribution. It's something else that made us behave that way or caused that end. It wasn't us. It's something else. And that's the fundamental attribution error. We blame things on external sources, where we put the power, the control outside of us if it's something that doesn't look good. So if you get a speeding ticket, right, the speed limit is 55 or 65, and you're doing 85 or 100. You're going to say, the gravity was extra powerful today, and it made my foot go down on the gas pedal more. I didn't do that, officer. It wasn't me. So you get the idea. So then, logically speaking, if it's you that creates or causes, and it's you that is the control for things that look good in your life, that there's a cause and effect, then logically the same is true too for things that may look bad on us when we make bad decisions. We are the cause and effect. We're causing things that are unfavorable to happen to us. Whether we just didn't handle it the right way, we didn't have good coping skills, we need to learn how to relate to people better. Anger management for some individuals. So, that's something to think about. What does that have to do with recovery? Well, it has a lot to do with being in recovery. If you're someone who's wanting to maintain your abstinence, we don't want to get, individuals can't get too, cocky, if you will, but the inability to properly manage relationships, manage stress, and those types of things are a part of recovery, and to help stay, abstinent from illicit drug use for those who use drugs as a means to cope, as far as, where they had problems and areas to work on in their life. So with this shift in thinking, taking the responsibility, that's going to empower you right there to start, changing your life in the direction you want to go in. Not just taking credit for good stuff, but also, taking responsibility for those areas where we make poor choices. Because at the end of the day, things just don't happen to us. Things don't happen to us. It's like the individual who goes out and drinks too much, and instigates a fight and then gets arrested and goes to jail because they just got a public intoxication and assault charges. And from their distorted thinking, they think that happened to them. See, things happen to them. They don't understand why. Well, if they take responsibility, it makes logical, perfect sense where the cause and effect was. It was their choices that caused the situation by which they went to jail. And that's where that needs to take place as far as understanding cause and effect with responsibility. So there's a lot more that can be said. If you want to leave your comments, feel free to do so. There's a lot of things that can be said, and I'm not making this video to, point fingers at individuals who are in recovery if perhaps they still are struggling with where the control is. So with recovery, as far as I'm concerned, to be in recovery and stay there is a change in the way you live. It's a change in the way you live your life. It's a change in what you value, and the evidence for that change in your value system is going to be evidenced and backed up by your behavior and your decisions that you make. I don't believe in people that are 100% a victim. There's no such thing as 100% you're a victim. Everybody has a part. You have your participation in everything. Even in situations where maybe you're not doing anything wrong and something out there may not be fair, you still have your part in how you're going to respond to that and how you're going to handle that. So something to think about as far as my thoughts, my philosophy is I do think people can be empowered. I think the agent of change is always going to be the person. It's always going to be the individual. And that's what it boils down to. Some people may need temporary intervention from a medical standpoint to get stable, and that's fine. But once you've had that help, once resources are being given to you and the opportunity is there, you got to take the ball and run with it. That part where you do what you need to do, make those decisions, no one can do that for you. So that's my 2 cents on recovery, and for me what that means for recovery with alcohol or drugs and so on. Maybe it's just for some individuals you have an addiction to certain types of behaviors, whatever it is, but you have to take responsibility as the person who's going to change it, what you're going to do to replace that behavior with something different, change your life. Sometimes that can be changing the people you're with and so on. And there's a lot to be said about mental, emotional relapse, and relapse happens up here in your head long before you physically go use a drug or have a drink. So that's it for today. I don't want to keep on going on and on because there's just so many things that can be said. So yeah, I've been a counselor for over 20 years. I'm a licensed professional counselor. I'm also a personal trainer in the fitness industry. I've had my I've been involved in both fields for over 20 years. So leave your thoughts and what you think. Feel free to subscribe to my channel. Whether you agree or not, or if you disagree, feel free to leave a comment. Like I said earlier, there's more than one path to recovery. Whichever ones they are, though, I don't think there's not many people who can argue that whatever path it is, it's always going to include the individual has to take responsibility for their program of recovery. They have to own it. It has to be theirs. Nobody can do it for them. Until I talk to you again, I hope you have a good day and hopefully a new year, which is upon.